Species. Unite.
There's a drug called vioxx that was found to be safe and effective in animal trials, so they moved it on to preclinical trials in humans. Once on the market, that drug caused 88,000 people to have heart attacks and killed 38,000 people.
Hi, I'm Elizabeth Novogratz. This is Species Unite. We have some exciting news at Species Unite. In January and February, we spent a lot of time in Bainbridge, Georgia, filming our first documentary. The movie is about Bainbridge, this small Georgia town that is fighting back against a big, wealthy company called Safer Human Medicine. Safer Human Medicine is planning the construction of the largest monkey breeding facility in the United States. This proposed prison for long-tailed macaques will be capable of holding around 30,000 monkeys at a time. These monkeys will then be sold to pharmaceutical companies for animal testing. Not only will this place be horrific for the monkeys, but it will also be absolutely horrible for the people of this town, for their water, for their soil, wildlife, threats of zoonotic diseases. And so the people of Bainbridge are in the midst of the fight of their lives. One of our partners in this film is the National Anti-Vivisection Society, NAVS. They are an organization that exists to end the exploitation of animals in science. This conversation is with Meredith Blanchard. Meredith is the Senior Manager of Advocacy and Policy at NAVS. And I asked her to come on the show to talk about animal testing, why it doesn't work, and why it needs to end now. Hi, Meredith. It's great to see you.
Elizabeth, I'm so thrilled to be here. I'm very, very excited. Thank you for having me.
Thanks for coming on. So many people don't realize, and I think a lot of it happened when we stopped testing on chimpanzees.
Yes.
I think in a lot of people's minds, we just stopped testing on animals.
Absolutely.
Do you run into that a lot? Like people say, when you tell people what you do?
Oh, yeah. Especially when I started this job and was trying to tell people about my new position. And they'd say, wait, we still test on animals? That's like a Stone Age thing. I haven't heard about this. You never hear about testing on animals. And I break the news to them that not only do we use animals in experiments, we use them to the tune of about 110 million animals a year just in the United States. It's a mind-blowing number.
Is that number higher than it used to be or lower?
It depends on kind of the species you're talking about. Overall, I'd say that number has been steady for a number of years. But there is a mind-blowing amount of money behind the use of animals in research. And so it has grown. Unfortunately, we're seeing the number of non-human primates specifically explode. It is going through the roof, the number of non-human primates used in research. We're seeing other animals, such as dogs and cats, steadily declining, which is great. But another part of this picture is because of lack of transparency on the side of scientists and research institutions, it is impossible to accurately count the number of animals that we use. So we really don't have a great picture of that and how it fluctuates from year to year.
And where do the numbers come from then?
Well, some base numbers to start with. So the USDA oversees the use of animals in research, along with the use of animals in entertainment, in zoos, in, puppy mills, all that sort of thing. But on top of that, they also oversee the use of animals in research. And animal use facilities are required to report annually on the number of animals they use, with a huge caveat. And that is that they report on the number of dogs, cats, guinea pigs, hamsters, rabbits, non-human primates, sheep, pigs, and other vertebrates that are grouped into just the term other vertebrates. They do not report on the number of mice, rats, birds, invertebrates, fish, cold-blooded species. And as you can imagine, mice, rats, and birds account for about 99% of the animals used in research. So we're only counting on an annual basis 1% of the animals used at best. And in 2023, that number came to almost 900,000 animals. So we know that number, that's a pretty solid number that has stayed fairly static from year to year. What we don't know is the number of animals that are not counted, but various studies have been done to try and extrapolate that number based on what is known, based on what's happening in Europe, where they actually do count all the animals. What a concept. And so that's where we kind of come up with this number of about 110 million used every year, as opposed to the 900,000 that are actually counted.
So aside from the fact that it's really cruel, it's just so weird.
Especially when you think about, like, in a laboratory, you have animal care people, you have the scientists, you have people ordering animals, you have people euthanizing animals. You have veterinarians that should be checking on these animals on a regular basis. You should be able to have an idea of the number of animals that you use. But time and time again, facilities say, absolutely not. This is too much of a burden for you to ask us to report on the total number of animals we use.
Let's go back a little bit. I want to talk about the word vivisection.
Yeah.
Because it is such an old-timey weird word.
It is such an old-timey word, I know.
And whenever I mention it to anyone, they are like, what are you talking about?
Yeah.
Unless they're very much in the know, pay a lot of attention to this stuff. And even one of the people that works on our podcast, she will take it out a lot of the time. She's like, no one knows what that means.
I didn't know what it meant either.
But the point is, we have been testing on animals since old-timey times.
Since Stone Age times.
And there have been people fighting it since, because the Anti-Vivisection Society was like the first animal rights society in the world, in the UK.
Yes. So it was, and where the term comes from, if you break it up, it's viva means live, section means cutting. The very first animal welfare organization, like you said, in the UK, was a group of people opposed to the live cutting of animals for science, which was basically, of course, back in the day, you strap a pig to a table or a dog or a cat while it is fully aware and awake and no pain medication, and you slice into it. And you say, oh, that's what a lung looks like. Oh, that's what a heart looks like. And that was vivisection. So that's where the term comes from. But you're right. Lots of people, when I'm out, doing tabling at events or something, a lot of people have to stop and do a double take and say, wait, what do you do? Because it is not a word that's used today.
And how did this end up being your work?
Oh, man, that is, I took a bit of a winding road to get to NAVs, but I'll say that no one who knew me when I was a child is surprised by the fact that I am doing this work today. I got my undergrad degree in zoology because I loved animals and I wanted to help them in any way that I could, and I had no idea what that could look like. So when I graduated with a degree in zoology, they said, well, you can work in a zoo. And I said, to be honest, I don't really agree with the idea of zoos. They said, oh, well, you can work with, departments of fish and wildlife. And I said, those are a lot of hunters. That's not really my jam either. So to making my parents very proud after 5 years of undergrad, I got a job scooping poop at my local animal shelter, feeding the animals and taking care of them every day. And I loved it. I was making like $8 an hour. I was hanging out with animals all day. I was helping them find homes. It was a fantastic job. And then I decided I needed to eventually move out of my parents' house one day. So I took another job at another human-based nonprofit. And I was there for 3 years. And the whole time I was trying to figure out how to get back into animal welfare. And it was really one of those, I didn't know what I was looking for until I found it type of situations. I eventually found this program, a master's program out of Tufts University called a Master's in Animals and Public Policy. And reading about it, I was like, you mean I can work within government and with laws to help animals? Like, yes, this is what I want to do. I didn't even know this was an option to me. So I went and got my degree at Tufts University, a master's in animals and public policy, which I highly recommend for anyone interested in getting into the animal welfare world. And then I got a job at, Humane World for Animals, previously Humane Society of the United States. And then I joined NAVS. And to be completely honest, I was not well versed in the use of animals in research. I was aware of it because I learned about it while getting my master's, but I wasn't super well versed in it. And I've jumped in and feel like I am learning so much every day. I've been here about 4.5 years now. I'm constantly flabbergasted by what we allow scientists to do to animals in the name of research. And I want to stop it.
And do you think, and I often wonder this, like with what we allow, because we allow so much egregious, nonsensical research
yes,
within this big scope of all the things happening to animals in science. Do you think a lot of it is because it's so out of the public? Like that, is that how they get away with it?
Oh, yes. It is very strategically hidden behind well-guarded doors.
Right.
I went to Colorado State University where I got my zoology degree, and it is a huge user of animals in science. I think the biggest in the state of Colorado. They use thousands of animals every year in research. I was on that campus for 4 years, 3 years, had no idea. I don't know where the laboratories were. I don't know where they kept the animals. I don't know where this science was happening. Had no idea. And colleges and universities are where the large, huge portion of animal research is happening. And most people walk around their campus with no idea about the tortures that are being done to animals on their campus and that they're funding, or the National Institutes of Health funds most of it, but that their tuition dollars are going to support these laboratories as well. And people don't know. They don't know the extent that it's happening. They don't know. And even myself, who has been digging into this deep for years, can't exactly tell you the experiences of animals in laboratories because it is so well guarded. And that's definitely on purpose because every now and then when information sneaks out, about what's happening, there's an uproar and people pay attention and fight back.
Will you give like an example or two of that, like when information leaks out?
A great example, and you probably remember this story. It was 2022, I want to say, when 4,000 beagles were rescued from this was not actually a facility where the science was taking place, but it was a breeding facility that sold their animals to research laboratories. And this facility had years of noncompliance violations by the USDA with nothing being done, no animals being confiscated, very limited fines. They were allowed to continue year after year, business as usual, even though dead animals were being found at the facility on a yearly basis. And finally, it broke through what was happening, the fact that these beagles were suffering in these awful conditions, that the facility wasn't even meeting the very, very minimal standards set by the Animal Welfare Act. There was uproar in the media by the public to the point where I believe it was the Attorney General in Virginia decided to bring charges finally. And they shut that breeding facility down and they rehomed 4,000 beagles, which is mind-blowing to me. I can't even fathom the work that went into that. NAVS has a sanctuary assistance program where we provide grants to sanctuaries that take in animals that were once used in experiments. And we had 2 or 3 grants go out in that time to help facilitate the care of those beagles at various rescues around the country, because it was literally a countrywide community came together to get those beagles into homes, which was amazing to see, but it should have never happened in the first place.
As positive as it was that those 4,000 dogs were rehomed and rescued, just like the chimpanzees, a lot of people thought that was the end of dogs in testing.
Really? Did you hear that from people?
I heard that from Shannon Keith, who runs the Beagle Freedom Project, which has rescued beagles from testing. And she said so many people came to her saying, well, thank God that's over.
Oh my gosh.
Like, the dog testing's over.
Yes.
And I think the reason, the same way people thought with chimps and testing was over, the human psyche doesn't want this stuff really to be happening.
No.
And so you hear a little bit of positive news and you're like, oh, phew. As much as all the stuff happening to animals, kind of anywhere you can throw a rock, something pretty bad's happening. But with the testing, it's just such deliberate torture. And they're living in cages. There's zero freedom. There's zero movement. And then they're actually physically hurt often.
Yes. Even if you take out the atrocious scientific experiments being performed on them, even if you take that out, just like you said, these animals are living in horrible conditions. Not necessarily, because it is a laboratory facility, they're not necessarily living in squalor. That's not what I mean. In all cases. But think of non-human primates, which are in 2023, we used over 100,000 non-human primates in research. And that number is just ballooning, it's just growing. And they are, by and large, kept in like stainless steel cages where they can't exhibit any normal behaviors. They're often housed alone. They're often not given much socialization, much enrichment, all of these things, because all that stuff is expensive and the money's going to the science, not really to the care of the animals. And think about the double-edged sword that scientists play, especially with non-human primates. They say, these animals are so similar to us, we have to test on them. But these animals are so dissimilar to us that it is ethically okay for us to test on them. And it's like, I feel like you're laying a trap here. This is not making any sense, you know? I can't imagine the psychological and emotional torture that those animals experience. And it's really the same with all of them. It's the same with dogs and cats and kept in these like sterile, very unnatural environments. And then whenever they do have interaction with humans, it's to be poked, prodded, cut into, that sort of thing. It's beyond beyond the imagination.
Why is the number ballooning with non-human primates?
A big part is because of COVID. So non-human primates did play a part. And this could be a whole nother discussion of whether or not COVID kind of helped or hurt the use of animals in science, because in one degree, they've now decided that we must test on non-human primates vaccines to such a degree, like that is the only way we're going to find the vaccines of the future and save humanity. You know, that's kind of how they play it up. But on the flip side of that, during COVID, a lot of regular regulations were suspended to say, you know, you don't need to necessarily test on 2 species of animals, one being a rodent and one being a non-rodent mammal. Maybe we can do human trials that coincide with animal trials type of thing. So they suspended a lot of rules that could help animals and help reduce the number of animals used. But they also decided, oh my gosh, if we're going to save humanity from the next pandemic, we need to test on hundreds of thousands of non-human primates. There's well, you know all about it. The facility in Georgia that is, I think that they have like $300 million or something to start building this facility.
Almost $400 million.
So you think about the amount of money. These people are building this facility to house 30,000 primates because they see a future where primates are used to a exaggerated degree and a very high degree. They see it there.
I'm sure people listening have heard me talk about this or have read our news stories on this, but we're making a documentary and NAVS is partnering with us about this town in Georgia, Bainbridge, Georgia, where the town is fighting against a pretty evil company called Safer Human Medicine. And in fact, the CEO was the CEO of Envigo, who was in charge of the 4,000 beagles that were in the squalid, horrific conditions dying in Virginia when they finally got busted. It's really bad stuff. And one question I have, because when we were in Georgia filming, and the more we learned about the primate industry, primates are now going for $30,000 to $60,000 a piece. Is all of this like this whole oh, we need more primates? Is it just money driven?
I think a huge amount of it is money driven. I think a huge amount of it is lack of interest in finding other methods, because when you think about how the career of a scientist, you get your undergraduate degree, you want to do a master's degree or like a postdoctoral degree or something like that, you need a mentor. And by and large, like the huge majority of mentors are people, if say I was wanting to study Alzheimer's, which they use non-human primates for a lot, and I am looking for a mentor to take me on as a graduate student, I am going to have an incredibly hard time, if not impossible, to find a mentor that does not study on animals. And to find a mentor who thinks that using non-animal models is acceptable and okay. One, the mentor is not used to using them, so they don't know how to use them or to teach them to a graduate student. Two, they are getting hundreds of thousands of dollars in grants every year, specifically to use animals. Three, they're trying to get published, and there is a huge bias towards animal use in publishing, because the people that review papers and the people that get papers put into scientific journals all use animals. They don't know how to evaluate a study that didn't use animals. And when they see one, they say, okay, this study looks good, but you also need to do it on animals. So it's this whole just like inertia behind how scientists are brought up. But it doesn't have to be this way. So NAVS funds a foundation called the International Foundation for Ethical Research, where we provide grants to early career scientists who are working either to develop non-animal models and bring them to market, or they're working on studying things like Alzheimer's or, some sort of toxicity, something, and they're already using non-animal models. And so the opportunities are out there a little bit. NAVS is trying to help get more people pushed in that direction. But it's really hard when you're an early career scientist trying to find your way. It's really hard to break into the non-animal methods.
Well, from undergrad on, right?
Yeah.
And so it's not even your first job.
I dissected a cow's eye in elementary school. And then as a zoology student, I dissected pigs, cats, snakes, worms, frogs, all sorts of animals. We start that at a very young age to say, this is okay. We're going to dissect these animals through your entire educational career because that's an okay thing to do. And that's how we learn. And it just doesn't need to be that way.
I think what we're also saying when we say that is this is necessary.
This is necessary and this is ethically okay because it's the only option.
And will you talk about how this doesn't really work? Testing on animals.
Yes.
Even if you are no, we really need to test on them. It's actually doesn't work.
Yes, absolutely. And this is I think this is why I'm still, after, years of doing it, fascinated by this topic, because I truly, truly, in my heart, believe, even if I wasn't the diehard animal advocate that I am, I truly believe that our reliance on animal models is keeping us from medical breakthroughs that could help people at large, help humanity, if you will. There's a couple reasons for that. So, the whole purpose of biomedical research is to increase human health, is to solve things like cancer and Alzheimer's and Parkinson's and sepsis and all these diseases. It is to make us live longer, healthier lives. That is the purpose of biomedical research. When you dig into what's actually going on, we spend billions, an average of $1 billion and 10 years to bring one drug to the market. And that one drug is the result of a 1% success rate of animal testing. So what I mean by that is that novel drugs, new drugs, have to go through animal testing, although there's a caveat to that we can talk about. But for decades, there's been a mandate in place that they go through animal testing before going on to human clinical trials, and then they're ready to go to market if they pass all those phases. So 90 to 95% of drugs that go through animal trials and are found to be both safe and effective, those drugs never make it to market. 95% of drugs shown to work in animals don't work in humans. That is a horrible translation rate, right? That is a huge failure rate.
It's also $1 billion for all the drugs that don't work and all the animals killed in the process for drugs that don't work.
And decades of research that has gotten us ultimately nowhere. We have effectively no treatment for Parkinson's, Alzheimer's, sepsis, most kinds of cancer. The list goes on and on. And even though we've poured billions of dollars and decades of research into them. So a success rate of 5% is basically what we have with these animal models. So there's a couple kind of really stark examples of this kind of failure. There's a drug called vioxx that was found to be safe and effective in animal trials. So they moved it on to preclinical trials in humans. Once on the market, that drug caused 88,000 people to have heart attacks and killed 38,000 people. That one drug. So the animal trials didn't work. Another example, there's a hepatitis B drug that was proven safe and effective in mice, rats, dogs, monkeys, and for some reason woodchucks they tested it in. And when it went into human trials, it killed 5 people, and 2 other people only survived because they got liver transplants. So these are drugs that we did extensive animal testing on, which cost billions of dollars and animal lives, and it didn't give us anything. It hurt us. It hurt human health. And so there's many examples of this kind of stuff happening where people should be demanding better from scientists. We should be. These are people that are supposed to be innovative. They are the smartest people, that many of us know are these scientists. And they are using methods that we first started back in the Stone Age and saying that is still the gold standard. And it's fascinating to me that they get away with it.
Will you also talk about some of the drugs that would never have gotten to market if we'd been testing from before testing on animals was a requirement?
Yeah.
Will you talk about that too? Because that amazed me.
Yes. So, if drugs that work well on animals have failed humans, the inverse is also most likely true, although it is not quantifiable, that drugs that did not pass animal trials because they hurt the animals or killed the animals or didn't do what they said they would do, possibly could be life-saving medications for humans. And there are some great examples of this, including one that you might have heard of, penicillin. Penicillin is fatal in guinea pigs. The only reason we have access to it today is because it was developed and brought to market before animal testing was mandated for drugs. Similar for aspirin. Aspirin causes embryo toxicity in rats and non-human primates. Would have never made it to market if it were developed using today's drug testing, drug manufacturing standards. And another, there's a pain medication called paracetamol. It is toxic in dogs and cats. It would never have made it to market if it had to be tested on those animals before human trials. So we are undoubtedly missing out on effective treatments for humans by relying on animal models, which is a disservice to everybody, animals and humans alike.
If we just got rid of testing now, what are the alternatives? Like what should we be doing instead? And what could we be doing instead?
Elizabeth, can you imagine a world where we have been using human biology to study drugs? Whoa. Like, I challenge people to imagine that world where we are using human biology to study diseases, study drugs, come up with these therapies, because there's a lot of exciting alternatives out there that, we can talk about this later, but that aren't being used, or at least aren't being used to the extent that they could be. So we have, I think, as we talked about earlier, we provide grants. The International Foundation for Ethical Research, which NAVS funds, provides grants to early career scientists that are working on the coolest human-based research. There's one grantee at Johns Hopkins named Dowlett Alam Eldin. This individual uses 3D brain models using human cells to study how a toxin called domoic acid might affect brain development. And the reason this is really important is because this toxin is found in algae blooms. And because of climate change, we're seeing more and more big, destructive, potentially very dangerous algae blooms in our oceans. And Dowlett is studying how this toxin that's in these algae blooms may affect the human brain and things like autism and ADHD, which of course we all know we're seeing it increase, at sky high rates on a regular basis. So she's using these 3D brain models, which is just like so futuristic science to me and so cool to think about. Another one of our grantees is Lunan Liu. He's creating a human organ on a chip to study pancreatic cancer, which is very hard to treat. So his model includes patient cells along with immune cells, blood vessels, and other human cells to help researchers understand why treatments work differently in different people for pancreatic cancer. So the route that he's taking is faster and more accurate than animal tests, and, which is very exciting from my perspective, it's kind of like individualized medicine. So not only could he look at, if I had pancreatic cancer, he could create a model based on my biology, my pancreatic cancer cells. So it's individualized medicine, and which is so futuristic. And I would trust that a lot more than saying, well, this worked on a rhesus macaque, so we think it's going to work on you.
Yeah.
These are fascinating, and I say futuristic, but they're here. The models are ready. They're ready to be used. I want to mention one more grantee of ours, Filipa Ribeiro, who is building a lab model of cervicovaginal area of the female body to study infections like gonorrhea. And her device mimics the real environment. It includes immune cells. It includes bacteria that's found in, the vaginal area. And it helps researchers understand how STIs work without using animals. And again, you could create this on an individualized basis to see how drugs might affect me differently versus affect you differently. And it's really cool work. So these options are out there. Another really big one to mention is computer modeling. It helps repurpose drugs. So there's computer modeling, there's these organ on chip, there's organoids. I mean, people are working on it, and these options are out there for researchers. But again, it's lack of uptake on the scientific side to actually use them.
Do you think with all the advances in AI and the stuff that's coming, especially the medical stuff that's coming, that we're going to end up phasing a lot of this stuff out because it's going to look so archaic?
Yes, I can only think, we talked a little bit about, institutional inertia, keeping these alternatives from being implemented. Another really big one is funding. The NIH, the National Institutes of Health, are the biggest funder in the world of biomedical research. And less than 0.1% of their funding goes to the development of these alternative models, non-animal models. Less than 0.1%. Mind-blowing.
And something like 50% of their money goes to animal testing, right?
Yeah. So we're talking billions and billions and billions of dollars difference.
And think of all the people who have suffered and died because we were focused on giving mice cancer so we could try and cure it in mice for how many decades?
And we have cured cancer in mice 7 different ways.
Right.
Can't do it in humans.
Right. The original FDA Modernization Act, which was from 2 or 3 years ago, said you don't have to test animals for new drugs.
Right.
But that didn't really work, right?
It didn't work, but still an important piece of legislation. What the FDA Modernization Act 2.0, it was the second time trying to pass this, what that did was change a long-held mandate that drugs had to be tested on at least 2 species of mammals, 1 rodent and 1 non-rodent. When the FDA Modernization Act 2.0 passed, it basically altered the definition of preclinical trials, which are animal trials, to include some of these alternative options. So it was basically the FDA saying, you no longer must use animals to get your drugs to market. You can use these other options as well. What unfortunately happened after that law passed, which was a great victory, is that the FDA didn't actually do anything about it. Laws are not helpful if they are not enforced. So if I'm a drug manufacturer, I'm trying to solve an illness. I am trying to also make money. I want to get my drug to market as soon as possible. Regulations still say that the best and fastest way to get my drug to market is to use animal testing. So that's what I'm going to do. Is kind of where we are right now. So there is a Modernization Act 3.0 that's been introduced to kind of facilitate the changing of regulatory language to say, to help drug developers understand that they don't need to, that animal trials aren't necessarily the best way anymore to move forward. It's pretty much shoving the FDA to say, hey, make this passed into law, but nothing else changed. Regulations didn't change. Let's, get the ball rolling on this is what 3.0 does.
Right. And that could be helpful, but it's still a really tough thing to change when people are still going to university and grad school, med school, testing. And so where are the breaks here? The whole system has to change because everyone's making so much money off of this.
Yes. Well, I have to believe, and then the numbers on this are very hard to find, but I have to believe that it is much cheaper for a drug developer to use non-animal models than to have the space to house all the animals they need, hire the personnel to take care of the animals, hire the veterinarians to take care of the animals. Animal care, when you're talking thousands of animals, is very expensive. And like you said, like non-human primates right now are costing $30,000 to $40,000 a pop. Like, that's an expensive way to do business. I really believe that if they had more or a clearer pathway from the regulatory agencies and from kind of like the committees that set up how we'll move forward, I believe they would change. That they would change over to these non-animal models. And a big stickler with this is with validation. We need the powers that be to say, hey, drug companies, you can use this kidney on a chip because it will accurately predict to this percent, whether or not your drug is toxic on humans. What gets me about this, and the federal government is not, moves at a snail's pace at best, and is not doing a great job setting up these structures to validate these alternatives that companies are making. The companies are making these non-animal methods, and then there's kind of a bottleneck to actually get them out to scientists. What just drives me crazy about this is that it's extremely hypocritical. Animal models were never validated. Animal models only work 5% of the time. So from where I'm standing, we just need a non-animal model to work 8% of the time for it to be better than an animal model. Of course, we want to see higher success than that. But in the meantime, we're stuck using these animal models that fail us 95% of the time. And it's very frustrating.
And waste so much money on things that could actually solve major, human health crises.
We all know people, or maybe ourselves, have diseases, have mental health issues, have health disparities that we say, man, I wish we had better treatment for this. And that's where I'm like, people need to stand up and demand better of science and say, you got to do better than this. You have got to move past these animal models that are failing at an excessive rate onto something that's going to be better for us.
Yeah, I agree. And of all the 110 million animals, and you might not know the answer to this because it's a weird question, but what is like the percentage of them that are being used on drug testing, and what is being used on like weird experiments and psychological torture?
It's pretty impossible to tell. I will say that we do know that the biggest chunk of animal use is happening in universities and colleges, which does not do drug testing and that sort of thing for the most part. That's happening, at big pharma companies. It's happening at colleges and universities who are just trying to study, I call it curiosity research, like, oh, what happens if I snip this, muscle? Or what happens to this cat's balance if I break its spinal cord at this point type of thing. It's basically curiosity, basic biological research that I would confidently say, although I is not leading us anywhere.
Well, and I would imagine all of it has been done repetitively for decades and decades, because how many things can you snip or puncture?
Absolutely. Yeah.
Not that the answers are meaningful, but the answers were probably known since the 70s or the 60s.
There are a lot of repetitive studies that go on. There's supposed to be some checks and balances in there to ensure that that doesn't happen. Those checks and balances leave a lot to be desired. And so there's absolutely repeated experiments that happen. There's, if you don't find something worthwhile to be published, then no one knows your experiment even happened. So you might use a bunch of animals and they didn't give you the outcome that you thought. And so you don't publish, and then no one knows not to do that to animals again.
The reason I ask this too is because if something like the FDA Modernization Act actually takes effect and you start seeing real change in biomedical, in drugs and all of that.
Yeah.
That doesn't really do much for all these poor guys stuck in, university basements
It's
who are
true.
like being forced to smoke cigarettes and have their eyes sewn shut and all the stuff happening there.
That's very true. Yeah. And I can't overestimate the amount of money that goes into this type of research. When I was kind of preparing for this podcast, I was looking at funding for one university. It was the University of Maryland in Baltimore. They were fined $8,000 for Animal Welfare Act violations dating over 3 years. So $8,000, okay, that's $8,000 is a lot of money to me. That university, over the same 3 years, where it was fined $8,000, got over $500 million in grants from NIH. So when a facility violates the Animal Welfare Act enough to get fined, which is very rare, usually they just receive warnings that don't mean anything. This one did it enough to such an egregious extent that it was fined over $8,000. Do you think that fine is going to change their behavior or improve animal welfare when this facility is over that same period making $500 million from the NIH or receiving $500 million? That's not a drop in the bucket. No. That's not a penalty to them. That's the cost of doing business.
And what are the alternatives there? Like, what are solutions there? Like, what's the hope for those animals in those situations?
Again, I would say the hope is a change in funding streams from the NIH.
Right.
We need to see the NIH say, increase its funding for the use of developing non-animal methods. And then scientists will focus on that. You follow the money, just like every other, corporation. Follow the money, and that money is being earmarked for animal tests right now to a overwhelming degree. And if the NIH flipped that on its head, we would see animal use go away.
Yeah, it's all money.
It's all money.
And it's all people really addicted to certain streams of money.
Yeah.
And no one wants to change anything because why would they?
Yeah.
Wow.
Right. It's business as usual. Change is scary, and I'm making a lot of money off of it, so why change?
And I want to just go back to one more thing that we already mentioned for a second. Because I think with elementary school, middle school, high school dissections that happen all over this country, and I'm sure a lot of other countries.
Yeah.
I think it's wrong for every reason, obviously. But a lot of what I think is wrong is it normalizes this stuff when you're like 9 years old or 12 years old. People just grow up thinking this is necessary. And will you talk about what NAVS is doing with that, with what's happening in schools?
Absolutely. I first want to ask you a question. Did you dissect animals in
the
elementary
day
school?
I was at 13 biology, I walked in and it was pig fetus dissection day.
Yep.
And I said, I can't do this. I'm a vegetarian. And I wasn't. And I walked out and I never ate meat, chicken, or fish again.
No way.
Yeah.
Wow. Yeah. That's
so
a great
for me,
story.
it was a really big deal. Like it was, and I had no idea it was coming. I just walked in. I was like, oh,
wow.
I'm out.
Yeah.
And that was it.
And you know how they get those pig fetuses for dissection? They intentionally impregnate pigs before they slaughter them for food so that they can have pig fetuses for dissection. It's the whole thing. So anyway, yes, ask anybody pretty much in the US, like, do you remember dissecting animals in school? And by and large, you will hear stories of how uncomfortable it made people, how much they disliked it, how much they didn't want to participate. And it really, when we do start doing that at a young age, like we talked about, it instills this normalcy to it. And it instills this idea that animals are on this planet for humans to, abuse in any way that we see fit. And so at NAVS, at the National Anti-Vivisection Society, which everyone knows what that means now, we have what we call our BioLeap program, where students, teachers, parents, anyone interested, we have a compository. Is that the right word? We have a database of dissection alternatives, where you can say, if I were a teacher, for instance, I would go to bioleap.org, and you can sort by, like, this year I was going to use frogs and worms for dissection, but I don't want to actually use animals. What are dissection alternatives? And we connect people with dissection alternatives. And we provide classroom grants to teachers who are interested in switching away from dissection. And so we say, we will provide $1,000 to you to purchase these models that are not actual animal carcasses for your students to use. And so between 2022 and 2024, we distributed nearly $34,000 worth of dissection replacement tools through our classroom grants. That went to about 40 classrooms. And we're hoping this year to do another 20 to 25 classrooms. So it is something that teachers and students and parents are looking for, to say, I remember dissecting as a kid, or I have a really empathetic child who does not want to cut into a frog. What are my options here? Because this is just morally not okay with me. Or maybe the chemicals that are used in dissection to preserve the specimens can irritate respiratory systems. It can hurt students' eyes. There's all these reasons, right? That someone may not want to dissect an animal. And so we help connect them to alternatives where they learn the exact same stuff. They learn where the organs are, how the different systems interact and work together. But you're not poking and prodding or getting like guts thrown on you by the silly boy next door,
No, that's awesome. And it's wise to just let kids know they have options as kids.
That's exactly it. And we also offer, if you don't mind me highlighting it, we offer a curriculum as well, kind of a humane curriculum for science teachers that is designed to meet national standards. So it's a humane way to teach science, to teach kids about alternatives when they're still in high school, so that when they do go to college or when they're doing their postdoctoral, they can say, I heard about this, I don't actually have to use this animal for this science. And so we're trying to reach them at a younger age, reach those future scientists and teach them humane ways of going about science.
I love it.
Yeah,
I love it.
It's wonderful.
No, everything you guys are doing is so essential, and it's change, right? And it's where we need to go.
It's a big beast we're trying to tackle.
Yeah, it's a lot. It's a lot. It's 110 million
and really
animals.
Everything. So there's a million different ways you could go about this, and we're trying to really hit those most effective ways that we've found. Can we end on a happy note?
Yes.
So just in the last 24 hours, so this is breaking news.
Give me some breaking news. In the last
24 hours, both the Food and Drug Administration and the Environmental Protection Agency, which we didn't really talk much about, but they use thousands of animals to test pesticides and fertilizers and that sort of stuff. Both the FDA and the EPA have made major announcements that they plan to significantly cut back on animal testing and animal research. So I'm cautiously optimistic. The EPA has made this announcement before and then gone back on it.
Yeah.
But for both agencies to come out and publicly say, this is a goal of ours, we must applaud and celebrate and then hold them to it.
I think so. Absolutely.
Yeah.
That's great news. Actually.
So that's some great news.
Well, Meredith, thank you. Thank you for coming on. Thank you for all the work you do and for being a partner with us in the film.
Thank you.
To learn more about Meredith and to learn more about NAVs, go to our website, speciesunite.com. We will have links to everything. We are on Facebook and Instagram at Species Unite. If you have a spare moment and could do us a favor, please subscribe, rate, review on Apple Podcasts or wherever you listen to podcasts. It really helps people find the show. I'd like to thank everyone at Species Unite, including Gary Knutson, Caitlin Pierce, Amy Jones, Paul Healy, Santina Polky-Link, Bethany Jones, Hannah Gabrielson, and Anna Kolner, who wrote and performed today's music. Thank you for listening. Have a wonderful day.